Thank you for joining us for today's Resource and Wellness webinar, Diabetes and Heart Health, in collaboration with the American Diabetes Association. Today, our experts will discuss how chronic diseases like diabetes can affect heart health. My name is Dr. Daniel Corboy, and I'm the Chief Medical Officer for the Humana, Illinois Medicare-Medicaid Alignment Initiative, also known as MMAI for short. MMAI is a health plan program for people who are dually eligible for Medicare and Medicaid. This is a voluntary program that improves healthcare for dually eligible beneficiaries in Illinois and allows them to receive all their healthcare services through one managed care plan. MMAI is now available statewide in Illinois. This expansion means that all Illinois residents who are eligible to receive Medicare and Medicaid coverage and benefits can enroll in this health plan. As we continue this expansion statewide, we strive to be present in the community to break down barriers in communication between members, community groups, provider groups, and managed care organizations. Our goal is to decrease confusion and provide services in order to best serve our new members. I hope you enjoy today's presentation.
Good afternoon, and thank you for joining us. I'm Rebecca Johnson. I'm the Corporate Development Officer at the American Diabetes Association in Illinois. I'd like to take a moment to introduce our special guests for today's webinar. Our moderator today, Sheila Harmon, has been a registered nurse for over 30 years and a certified diabetes care and education specialist for over 13 years. She is an advanced practice nurse, clinical nurse specialist. She is currently the Director of Provider Practice at University of Illinois Miles Square Office of Community Engagement and Neighborhoods Health Partnerships, school-based health centers. Mrs. Harmon is currently a community board member for the Chicago chapter of the American Diabetes Association. She is a community health educator for Sisters Working It Out, a cancer awareness and health advocacy nonprofit organization dedicated to serving African American and other minority women in medically underserved communities on the south and west sides of Chicago. Mrs. Harmon received her bachelor's degree in nursing from Chicago State University in 1988 and her master's in nursing as a clinical nurse specialist in 2007 and as a family nurse practitioner in 2013 from Governor State University. She is currently enrolled in the UIC College of Nursing Doctorate of Nursing Practice program. Mrs. Harmon travels throughout the city of Chicago and other cities in the United States, providing diabetes education to help empower people with the knowledge to know how to prevent, control, and slow the progression of the disease. Her motto is, "Take control of diabetes before it takes control of you. You are empowered." Our other special guest today is Dr. Charles German. He is a board-certified cardiologist who specializes in preventative and general cardiology. Dr. German works with patients who are at risk for heart disease to collaborate on individual treatment plans for each patient. Dr. German is passionate about using his expertise in preventative cardiology to help his patients avoid or slow the progression of heart disease. His methods include everything from exercise and lifestyle modification to advanced lipid testing and medication in order to personalize care to meet his patients' specific needs and deliver the best outcomes. Dr. German also has experience treating patients with genetic cholesterol disorders, difficult to control blood pressure, obesity, and metabolic syndrome. Along with his devotion to his clinical practice, Dr. German also conducts ongoing research that can help predict and prevent heart disease. Specifically, he has a keen interest in physical activity research, trying to understand how different types of exercise and physical activity mediate heart health. His work has been published in several highly respected peer-reviewed journals, including American Journal of Cardiology, Heart, European Journal of Preventive Cardiology, and American Journal of Hypertension. As a physician, Dr. German understands the impact that mentors can have. So he takes his teaching opportunities seriously. He plans to guide medical students, residents, and fellows throughout their career through practical training and lectures on topics related to preventative cardiology. Welcome you both to the program today, and I will let you take it from here, Sheila.
Thank you, Rebecca, so much. Thank you for the opportunity to be here, and especially to be able to share this platform with Dr. German. Just so excited for the information that you're getting ready to share with everybody who has joined us today. So we want to go ahead and get started. And Dr. German, one of the first things that I want to ask is, what are the risk factors around heart health and diabetes?
Mm-hmm. Well, thank you both for having me. I'm very excited to be here. So there's a strong relationship between diabetes and heart disease. A lot of risk factors for diabetes are also similar risk factors for heart disease, and there are many different types of heart disease, and the most common type is atherosclerotic heart disease. So this is hardening of the arteries that supply blood to the heart muscle. And the risk factors are high blood pressure, high cholesterol, being overweight or obese, and then poor lifestyle factors. So being sedentary, not exercising, and eating things that are not necessarily good for the heart, which are high fat foods, fried foods, salty foods. These are all risk factors for the development of both really diabetes and heart disease. And we know that once a person has diabetes, or even pre-diabetes, that increases their risk pretty substantially of heart disease. So my job as a preventive cardiologist is really to identify people that are at risk for heart disease. And so that includes people with diabetes or pre-diabetes, so that we can really reverse the trend and do everything possible to get the lifestyle in order, sometimes using medications to really prevent something like a heart attack or stroke.
So that's great information to be able to know the risk factors. And I heard you when you said you're a preventative cardiologist. And so your role is in working with patients to be able to identify those risk factors, to help them be able to make some of those lifestyle changes to be able to prevent heart disease. So can you share with us, why are we seeing a rise in the obesity rates, and how does this also affect, heart health and diabetes?
Mm-hmm. Well, it's a great question. Over the past 10 or so years, we've seen rates of both risk factors and heart disease decline. And unfortunately, over the past few years, those declining rates have really become stagnant. And so instead of the trends going like this, they're sort of evening out, potentially plateauing, which is quite disheartening. And I think we know that, like you mentioned, Sheila, the rates of being overweight and obese are going up. The rates of diabetes are also going up. And it's a very complex, troubling situation that we have ourselves in as a country. And I think these difficulties have been exacerbated by COVID. COVID is something that we're still dealing with. Hopefully, knock on wood, things have been better here, more acutely. And we saw some interesting trends. We saw initially, when everything started, people were not going to work, they were working from home. And when people had more time, at least initially, I know it's common for me, maybe common for you all, people went outside more. They were walking more, they were exercising more, they were getting out. And so I think initially we were moving in the right direction. But as things sort of progressed, and as humans, sometimes we fall off the bandwagon, and that sort of stopped. People were again not going to work, so maybe at home, maybe they were a little bit more sedentary than they'd normally been, not going to grocery stores, and maybe not having access to healthy foods. And so with COVID, we've, at least over these past few years now, it's really just exacerbated what we've been seeing. So weight has increased across the board. And then all of the other associated poor risk factors, high blood pressure, et cetera, have unfortunately gotten a little bit worse. And it's something that we really need to get a hold of now so that we can try to reverse and reduce those trends so that we can ultimately reduce heart disease, which remains the #1 killer of both men and women in this country. So we need to do better.
You know, you brought up some valid points that we have been seeing in our practices as well. You know, COVID, so many people have been talking about how much weight they have gained. Like you said, that sedentary lifestyle, COVID has not allowed us to get out the way we have been, you know, not being able to get to the gyms and not being able to get out and walk. And like you said, limited food choices and being at home. And those are things that we really have to be mindful about. You know, I have type 2 diabetes and I gained 5 pounds during this time, and it's hard to get those pounds off, right? But being able to identify what things can I still do at home, being active, remembering to keep moving, you know, what things can you have at home, being able to, if I'm watching TV, to, you know, lift some weights or use some cans or put water in the jugs to, you know, make you some weights. But that's something we want to be mindful about, right? And so you know, those are some points that were really valid that you talked about. And when we look at our own selves, especially those of us that are living with diabetes, we have to start saying, what can we do to stay active? What can we do to decrease some of our risk factors? You know, can you talk a little bit more about the trends in cardiovascular treatments and the reversing trends?
Sure. Well, I want to, you really hit on a good topic, and I can share a little bit of, before we get to the maybe some of the medications. You know, I see a lot of patients in the South Side of Chicago. That's where my practice is, at the University of Chicago. And being able to exercise and have access to healthy foods is so important, particularly in the patients that I see and I treat. And something that was quite shocking to me as a relatively new person to the city of Chicago is just the environmental factors that make it difficult to have a healthy lifestyle. So as a physical activity researcher, and I'm also the director of our cardiac rehab program here. I do a lot of counseling on exercise and the benefits of exercise. And having some patients tell me that their neighborhood is not safe to walk in was really quite troubling, and something that I had not experienced before. So it's a very, very complex situation that we're in. But the good news is that even if you're in the home, not outside, or not, you can't go to the gym or don't have access to the gym, really any activity, any movement is better than none. So one of the things that we have these physical activity guidelines that came out just a couple years ago. And, you know, we used to think that to really get the benefits of exercise and activities, that you really had to do high intensity activities to really get your heart rate up. And we used to say that it has to be at least in 10-minute bouts or 10-minute spurts of activity. But really over the 10 years, as we've learned more, that's probably not the case. We've learned that you don't necessarily have to do that high intensity activity, even doing low intensity activities, just doing cleaning, chores around the house, going upstairs. These things you still get benefit from. So any activity with whatever limitations you may have is better than none. And even just not sitting, so even walking and not being sedentary, you get benefits with regards not only to heart health, but also for diabetes as well.
And I think that's just so important, like you said, that we have to be able to get moving, find something that we can do even within our homes, because we have a lot of people, as you said, they're in communities where they don't feel safe. They can't go outside, you know, looking at what else we can do. I know there are areas that are teaching how to do gardening, maybe in their backyard. being able to do that housework to get that activity in. Like you said, just, going up and down stairs. So it's so important that we look around our environment and we say, well, where do I feel safe? If I feel safe at home, what can I do in my home to get moving? And like you said, just being able to move and do something. I like the fact that you're bringing this information to help us understand your role as a preventative cardiologist. You're trying to prevent some of these greater complications that we know will be occurring with the heart. And with that, can you kind of talk a little bit more to just really make sure that our audience and our participants are really understanding the correlation between diabetes and heart health, so that we can really be able to look at those things, especially when you're somebody like myself living with diabetes?
Sure. So the correlation between diabetes and heart health, it's a very strong risk factor. So really, if you think about diabetes, it's a form of insulin resistance where your pancreas doesn't make insulin, and when your pancreas doesn't make insulin, that's sort of how diabetes develops in the body, and that leads to hardening of the arteries. So when we talk about plaque, as a cardiologist, we talk a lot about plaque in the arteries. And if you develop plaque in the arteries, that plaque can rupture and cause something like a heart attack, or if it happens in the brain, it can cause a stroke. So really the link is through the development of that plaque. Sometimes it's related to cholesterol as well, but all of these risk factors eventually come together to develop plaque or cholesterol in the heart arteries. So really the goal should be to get these things controlled as early as possible, because once plaque develops in the heart arteries, it's not really reversible. There's some medications that you can try to regress plaque or make it go down. But we certainly don't want it to progress. And so if the diabetes is not controlled, if blood pressure is not controlled, blood sugars are not controlled, this can lead to the progression of that plaque in the arteries, and that's predisposes you to some of the bad cardiovascular outcomes that we really try to avoid. So, the best way to prevent this from happening is really having a healthy lifestyle from the get-go. And this is something that we really preach a lot in cardiology, is it really starts from birth. We see that plaque actually starts to build in the teenage years, which is quite surprising. And we know this from autopsy studies from the 1940s and 1950s. And so this is a very long process that takes decades before something happens. And so the problem is that it's not something that you feel. You don't feel plaque building in your heart arteries until it's too late, until you have that heart attack, or until you have terrible chest pain or something even worse. And so the issue is that it's not something that symptomatically people feel until it's a little bit too late. So the earlier we can get control of the risk factors, the earlier that we start to exercise, and we have to sustain it over the lifetime. That's really the goal and the key to sort of prevent both diabetes and then subsequent heart disease.
And that's so important for everyone to understand. One of my mottos is take control of diabetes before it takes control of you. And one of those things is, like you said, understanding that it starts with our children, right? It starts in our adolescence. And when we have a family history of this disease, it's so important that our family understands the disease, so that way they'll know what things to put in place. Because, you'll look at somebody and say, oh, well, they're not overweight, they're doing fine. But like you said, we can't see our vessels on the inside. We don't know what's happening. We don't know what's going on. So it's so important that we do preventative measures, that we practice on taking that control, like you said, so that way we can decrease the amount of plaque that may be growing that we don't see, that we be able to become physically active and getting some type of exercise day. And I'm glad you shared that. To go back to talk about it, starts with adolescents, right? With our kids. And so even with this pandemic, when we start to look at our kids now, and if they're just sitting at home on the computer, or they're just exercising their thumbs with the video games, it's so important that we get them up and moving, doing some type of activity that they can do in the house. I know a lot of times we don't want to tell the kids, stop running in the house, but if it's not safe for them to get out, we need to find a place that they can run around in the house, or
Right.
where they can just really be busy so that we can keep them active. And not only that, I always encourage parents, let your child join a sports team, because they're exercising all the time with practice, and they're really working out. And those are things that can help keep them busy and active as well. So can you talk a little bit more about, lifestyle choices and some of those lifestyle changes that we need to do? Because I think what people don't realize is, oh, I did this and I got my A1C level down, I'm feeling a little bit better, okay, I can go back to these things. But no, lifestyle means the rest of your life. It is a change that you're doing to have that better quality of life. So can you share some of those lifestyle changes or choices that we should be making?
Sure. No, you're exactly right, Sheila. It's really the cumulative effect over time. That's really the key. And so, I talked a little bit about exercise and physical activity, and this is something throughout the life course that you have to do in order to get the most bang for your buck as far as prevention. But besides just exercise and activity, diet is really the other big thing that we have within our control to reduce our risk of diabetes and then heart disease. So what are the things that are most important? So for me, as a cardiologist, I see lots of people with heart failure, for example, and salt is something that we really discourage. So salt, but also for the development of diabetes, because salt is really a driver of high blood pressure. And so reducing salt, if you want to be specific, it depends on different guidelines, but trying to keep your salt level 2 grams or less. Sometimes we're a little bit more stringent than that, but I think that's a nice round number that's easy to remember, is important. And something that really goes along with really diet in general and salt is just knowing how to read a food label. So I really encourage all of my patients to look at the labels when you go to the grocery store, look at the nutritional facts, look at how much cholesterol in there, look at how much sodium is in there. Sodium is salt. And then I'm also very fortunate to work with a nutritionist, a dietitian, and she really has a good, solid hour of time to really go over some counseling, because, this is your life. And you really have to take it upon yourself to learn what the healthy things are so that you can make sure that you have not only just a long life, but a healthy long life. And so in addition to sodium and salt, we generally don't try to be too specific as to eat this food, don't eat that food. It's really more the pattern of eating that other organizations like the American Heart Association has really tried to put forth. And so I would say there's probably 3 really solid diets that we know are the most beneficial for heart health. And so one is the DASH diet, which is a very much sort of low sodium based diet. In addition to the DASH diet, there's something called the Mediterranean diet, which maybe many of you may have heard of, which olive oil is in some fatty fish, healthy fatty fish, I should say, is prominent in that diet. And also plant-based diets. There's maybe a little bit less data behind plant-based diets, but everything thus far is pointing towards that plant-based diets are really, really good for the heart compared to maybe more congenial American diets. So, probably don't need to go into the specifics of each one of these diets, but they all have very same themes So besides the low salt, healthy oils, olive oil is good. Healthy fats are things like nuts. In general, nuts are a good healthy fat source. Fish is also probably the best meat. We want to generally try to avoid processed meats, which usually has a lot of salt in it. We want to try to limit things like red meat, maybe once a week is probably fine, but fish, chicken is probably better. We want to try to avoid frying as much as possible. And so baking is a lot more healthy for the heart and for diabetes risk as well. Obviously, eating lots of fruits and vegetables, also very good. And then beans is another good source of protein as well. So really not necessarily earth-shattering stuff. And I think a lot of us know this is just, it's much harder to implement these sorts of dietary changes. But these are really potent things that we can do, that we have control over. You know, it can be discouraging sometimes because there are some things that are out of our control, right? So our family history, if we have a genetic predisposition, and even diabetes, we know that people with a family history of diabetes, there's a sometimes 2 to 3-fold increased risk of developing it. So we know that there's some genetic components which can be discouraging. That being said, we know that if you adhere to the healthy diet, to the exercise, the things that are within our control, we can really help lower even a genetic risk. So these are things that I think are really important and encouraging, even if you have a genetic predisposition to something like diabetes or heart disease.
I like what you said there. The information you gave was fantastic. And, you know, when we talk about, it's hard for patients, and sometimes people get turned away, like you said, from that word diet. But when you start thinking about it as healthy eating, lifestyle behavior, you become more of, I'm not dieting, I'm just eating healthier. I am doing mindful eating, right? Mm-hmm. I'm mindfully choosing the way I decide to eat. I'm mindfully choosing when I exercise, how much I exercise, how I exercise. And so, you know, we want to mindfully be able to say, listen, I can control this disease. You know, I can manage what I need to do. And what you said was control the things that we can control, because there are enough things that we can't control. Like you said, we can't control our family history. We can't control heredity. We can't control our genetic makeup, but we can control what we, how much we eat, how often we eat. And again, we can control being physically active. For those that have joined us, if you go to diabetes.org, there are so many diabetes resources there that you can refer to. There are meal plans. There are ways of cooking things differently. You know, I always share with my patients, it's nothing wrong with the way Big Mama and Grandma and everybody cook things. But back then, you have to look at their lives. They were active. They might have been in the field. They might have been working a garden. There are so many things they were doing that we're just not doing now, right? And so some of those recipes we need to modify. Instead of having foods, those meat, the fat bag, those things that are high in salt, we want to switch and find something else that we can use it with, you know, some fresh turkey or something. If you go to diabetesfoodhub.org, again, diabetesfood.org.hub, and the information is in the chat, that you'll be able to see some of those menus, some of those recipes. Somebody is asking, how do I get certified as a diabetes educator? I'll address that a little bit later. You want to go to the website for the Association for Diabetes Care and Education Specialists to get information about how to become a certified diabetes educator. But we need more diabetes educators. We need more teams to be able to work. And I like that you have a team that's working with you, Dr. German, to be able to help you, because it's only so much you can do with the time that you're with your patients, but being able to have that team approach to work with you that can be able to answer some more of those questions. So, we talked about the food, we talked about the physical activity that we can also incorporate in our lives. Kind of share with us some of the pharmacological therapies and what we should know about those as well. Because for some people, at some point, they are going to have medication. Mm-hmm. If you're not willing to make those lifestyle changes, we want to be able to help your body as much as possible until you're ready to say, yes, I'm going to be committed in exercising. I'm going to be committed in eating healthier. So what are some of these pharmacological therapies that we should know about?
Sure. So you're absolutely right. So the backbone of diabetes care as well as heart health care is always going to be healthy lifestyle, the things that we've been talking about. But eventually it may get to the point where that's just not enough. And we really need to start some medical therapy to get these risk factors under control. So, the background of diabetes care has been and continues to be metformin, which is the most common medicine, and metformin is backed by decades of research and excellent safety profile as well. So for most people, that's where it starts. Now, over the past, not even 10 years, maybe 5 or 6 years, there's been 2 relatively new classes of diabetes medications that have really been shown to be super beneficial for heart health and heart disease. In fact, I believe the FDA has sort of mandated now that every new clinical trial for new diabetes medications that comes out, they need to look at heart outcomes because, like I was saying, the most deadly downstream effect of diabetes is heart disease and heart attack and stroke. So we not only do we want to make sure that these medications are improving our A1Cs and improving our fasting glucose levels, but we also ultimately want to make sure that they're helping heart disease as well, which is the most feared complication. So these 2 major classes, their names are sort of complex, but one is called an SGLT2 inhibitor. And these are medications like empagliflozin or dapagliflozin or canagliflozin. And these are oral pills. And then there's another class called a GLP-1 receptor agonist. This is a medicine. So some of these medicines are liraglutide, semaglutide is another one as well. They all end in utide, and these are typically injections. In both of these classes of medicines, not only have they shown improvements in hemoglobin A1C and diabetes control, but they've also been shown to reduce the rates of cardiovascular mortality, meaning they make people live longer, and they have less heart attacks and less strokes. And sometimes, particularly the SGLT2 inhibitors are particularly beneficial for people with heart failure. So effective, in fact, that we found that they benefit people even if they don't have diabetes, but they have heart failure. So these 2 classes have really changed the game, I would say, as far as diabetes care, and they're becoming, our indications for these drugs just keep expanding. We find new people and new patients that benefit for these, even if they don't have diabetes, which is quite remarkable. So these are the newest medications on the market that are very, very potent and incredibly beneficial for people with heart disease. And so, of course, there are always caveats with when we can and cannot use them. And so we always want to make sure kidneys are okay, because sometimes these medicines affect the kidneys. And obviously, there's a lot of preference. If some people may want to avoid an injection, maybe an oral pill would be better, or vice versa. Another major benefit, particularly of the GLP-1 receptor agonists, is that they reduce weight. So they have pretty potent weight loss effects as well, and it increases your sense of fullness or feeling full after eating. And that's sort of how they work with regards to weight. There was a major study that came out a couple years ago called the STEP trial that looked at semaglutide, which is a GLP-1 receptor agonist. And we found that at relatively high doses of that medicine, people lost up to 50, 60 pounds, which is really quite remarkable. We've never seen a medicine that produces that amount of weight loss, but not only just weight loss, but it's sustained weight loss over time. And obviously there's a big link between weight and diabetes. And so it's good for so many different reasons. And if you can reduce the weight, you can reduce the chance of diabetes, you can reduce the heart disease. So it helps lots of different risk factors. So, you know, I'm a cardiologist, I'm not necessarily a diabetes doctor. That being said, because of all of these cardiovascular benefits that we've been seeing, cardiologists are becoming much more savvy with diabetes care. And I think it's important because it takes a village. You know, we all need to do our part as healthcare providers to provide the best care for our patients. And if rates of diabetes are going up, we really need to take it on ourselves to become knowledgeable and savvy with these medicines, as I've been doing. You know, I can tell you it's unfortunate because we see a lot of patients. For example, I'm seeing patients in the hospital right now, in fact, that may come into the hospital with a heart attack, and then you see that you check their A1C because you want to know what their risk factors are, and then you are the one that diagnoses them with diabetes in the hospital, when in fact they should have been diagnosed much earlier, because if we could have found the diabetes earlier, then maybe we could have prevented that heart attack from happening. So as a cardiologist that sees people with heart attack and stroke and heart failure, I make the diagnosis quite often, which shouldn't happen. You know, we want to catch it early so that we can prevent these downstream effects. So another thing I wanted to sort of mention too is within my field, within cardiology, as I mentioned, we're getting more savvy with regards to diabetes management and control. And so some places around the country are actually forming an alliance with the endocrinologists. So these, you know, endocrinologists are really the diabetes specialists, so that we can really together come up with plans to manage our patients, not only their diabetes, but also their heart disease risks. So these are things that are very new. They're popping up all over the country. We're working on one here at the University of Chicago to really collaborate collectively to provide the best care for our patients. Sheila, I have to take a quick phone call. Give me 1 second.
Okay. And when just to recap on some of the things that Dr. German is saying, you know, it's so important that we have a relationship with our primary care team, that we should go in, you know, when you have diabetes, we want to get that when that A1C level is greater than 7, we want to be able to get that measured at least every 3 to 4 months. And so you should have a primary care team so that way you can go in. So when you have, you know, things that if it's your primary care is having a difficult time getting your A1C level down because they're working with you and you're actually changing your eating habits, you're actually becoming physically active, as Dr. German was just talking about, you know, we're looking at the concept that says patient-centered care, where we're looking at having a team approach of how we care for the patient. So that includes everybody, from when you come into the clinic and you register, helping the receptionist know how to give you that return appointment. When you get to the back, whether you're being triaged and assessed by a medical assistant, by a nurse, to be able to get that health information that we need from you. And some of the things when you're going to the doctor, you want to have your list, because this is shared. This is a shared event. So when you come in, shared decision-making means that we work with you. We are part of your team, and our goal is to help you be able to manage and control your diabetes. And being able to do that, we need to know things about you, and you are your best historian. You are the best person to tell us the story. You know if you're having any pain in your hands or your feet that might be a part of neuropathy. that we might need to get, you in to be able to see, a doctor to be able to look at those nerve endings, whether we need to get you in with the vascular team. That if you're having issues where, how often you're urinating, or, how less you feel like you're going. And so part of this journey and being able to manage and control diabetes is knowing that you have a medical home that you can go to. And with that medical home, we're focused on patient-centered care, which means it's a team approach. And that's what Dr. German was kind of sharing. He's the cardiologist. He's a preventative cardiologist. He's going to be communicating with the endocrinologist to work together with the primary care. When you think about it, your primary care doctor is like the housing everything about you. And then there's this team, but you're in the center of all of it. And all of us are here to work with you. You're a diabetes educator, you're a nutritionist. We even have, pharmacists that work to help you understand your diabetes. So Dr. German, one of the things I wanted to be able to share with our participants, because we have some providers on the line, we have nurse practitioners, we have, patients, people with diabetes, nurses, we have so many different disciplines that have joined in on this session. When should they send patients to see you? Or if I'm a patient, how do I know how to ask for a referral because it's time to see you? So at what point in my diabetes journey should I see a cardiologist?
That's a great question. And I apologize, I had to take a quick phone call with regards to a patient in the hospital. It's a very good question. Certainly, if you're having any sorts of cardiac symptoms, that's really the first obvious sort of answer, is that if you ever develop chest pain or significant shortness of breath, those are things that absolutely you should see a cardiologist about, to really sort of tease out what's going on. But hopefully that doesn't happen, because we want to catch these things before you develop symptoms. And so if you ever have concerns about risk in general, let's say you have a strong family history of heart disease, that's what I do as a preventive cardiologist. So there are specific tests and things to really help refine your risk, which takes into account diabetes, but also takes into account some genetic abnormalities, family history. We can delve a little bit deeper into sort of lifestyle to really refine risk to more of an individual level. So when we talk about risk, there's a very nice calculator that was developed by the American Heart Association, the American College of Cardiology, which takes into account a whole bunch of risk factors to see what is somebody's risk of developing a heart attack or stroke over the course of about 10 years. Now, that risk calculator works for the majority of people, but there are some caveats to that. And so as a preventive cardiologist, I'm aware of the caveats, and we can really refine risk prediction for each individual person. So if you have strong family history as well, that would be a good reason to see a cardiologist. So the other thing too that may be good is to talk about statins. And so I think statins get a lot of stigma, particularly in the media, but statins are a type of cholesterol medicine that's really, if I had to say one medicine that is the most potent at reducing heart disease, it's a statin. And we have at least 40 plus years of efficacy, meaning we know that they work over decades, and we prescribe this medicine every single day. There are literally millions of people in the United States on statins because it's our most potent, strongest medicine to prevent heart disease. So we know from cholesterol guidelines through the American Heart Association that just by having diabetes, that's a strong enough risk factor that you should be on a statin. So doesn't even matter what your cholesterol numbers look like. If you have diabetes, you should at least be on a statin. Now the potencies can be different, but if you particularly have questions about statins or cholesterol, that would also be a good reason to see a cardiologist, particularly a preventive cardiologist as well. So I would say symptoms, number one. If you ever have symptoms of heart disease, even palpitations, that's a very good reason to see a cardiologist. Two, if you're concerned about your risk, strong family history, or you have questions about cholesterol management, because cholesterol and diabetes are tied closely together, those would also be good reasons to see a cardiologist as well. And if you ever just have questions about risk in general, I want to know what my risk is specifically. There's some tests that we can do. So one of the maybe more specialized tests that we do in my world is something called a calcium score or a calcium scan. You may or may not have heard of this, but basically what we do, it's a CAT scan of the heart, and we look for calcifications within the heart. So the only thing in the coronary arteries that calcify is plaque. So if we see calcium, that means that you have plaque, which means that we really need to get the lifestyle in order. We really need to make sure the blood pressure, the cholesterol, the diabetes is under control. So this is a very effective way to really objectively see you have some very early evidence of heart disease, and we don't want it to get worse. So that's one way to really help refine our risk to the individual person, to show us how strict and stringent we really need to be about getting these risk factors under control.
That was really great information. I didn't even think about some of those things, but again, when we keep talking about that word preventative, when you live with diabetes, our goal is to prevent the complications of the disease. And what you were able to share is being able to get that referral, because at that point you can say, well, you look fine, you're doing good, you don't need to see me again, maybe come back in a year or 2 years, communicate with that with your primary care provider, but at least you were able to get that evaluation. And I think that's so important, especially as providers, to be able to refer our patients, to make sure that we are doing all that we can do as providers as well to help our patients manage the disease, but really, really focus on that preventive care. I know one of the things that I want you to talk about now is reversing diabetes, but we also got a question that came in that asked about if you can reverse heart disease. And so if you could maybe talk about both of those, reversing heart disease and then talk about reversing diabetes.
Sure. So one of the most encouraging things, I think, in diabetes care is that this is something that's actually curable, potentially, and reversible, because we define diabetes, most clinicians define diabetes by the hemoglobin A1C. And so say your hemoglobin A1C is 7, so 6.5 or above means diabetes. So with a healthy lifestyle, with weight loss, with exercise, you can get that A1C below 6.5, in which case you no longer have diabetes, in which case you're sort of cured. Now, the important thing is that you're able to maintain that over the life course, because if you fall off the bandwagon, those risk factors can go back up and your A1C can go back up as well. But there are very few things, at least in my world as a cardiologist, where we can say that we've cured something. But this is something that we really, with good lifestyle habits and healthy lifestyle choices, that you can potentially cure your diabetes and no longer need medication as well, which is always a major win if we can reduce medications, the costs with medications, the pill burdens. It's really very encouraging that a healthy lifestyle can reduce and not only reduce the trends, but potentially cure the diabetes.